There are very clear differences between eczema or atopic dermatitis and psoriasis. Dermatitis is more of an umbrella term, just means you have a rash. And we often are on the hunt to try to figure out what the exact diagnosis for this certain dermatitis is. But atopic dermatitis or eczema and psoriasis are very defined conditions. Atopic dermatitis or eczema can often start in childhood. It has a very specific infantile distribution, which is like cheeks and belly. And then as children get older, it moves to arms and legs, and sometimes feet and wrists. For many people, you outgrow your eczema as you get older, as your oil production improves. Some people maintain their eczema or atopic dermatitis lifelong. Your immune system has kind of two arms. You have what we call a type 1 arm, which is designed to look for cancer and to kill things like bacteria and viruses. And then the type 2 arm is more attuned to allergy. Atopic dermatitis or eczema is a type 2 process. People often have concomitant asthma, or they have seasonal allergies, or they have family members that are affected with those kinds of things. The chemical cascade that causes that reaction is very specific. Psoriasis, on the other hand, is a type 1 process, meaning it's a different form of your immune system. This can actually occur at any point in your life. We do see children develop psoriasis. We see adults develop psoriasis. Psoriasis is much more well-demarcated, really red, scaly plaques. It tends to be more of what we call an extensor process, where it's elbows, knees, back of the neck, scalp, that kind of thing. But there's also a gutty form that looks like it rained all over you, and that is either a strep infection. Sometimes you can take completely clinically. Somebody comes in with red scaly patches on their elbows, more likely to be psoriasis, red like scaly patches, but not quite as thick on the flexor surface, kind of inside your elbow. That's more atopic dermatitis. So they look different, but sometimes there are people where you can't tell the difference, and the definitive diagnosis is made by skin meds.